Welcome to PLAC Podcast, brought to you by the 2026 Legislative Internship Program Court. The subject of health remains crucial, but more often than not is relegated to the background because of certain indices, of which poverty plays a crucial role. And it begs the question, are social protection programs in Nigeria any active? What becomes the lot of those who pay out of pocket and the struggling young professional trying to stay healthy? This and more is what we discuss on today's podcast. My name is Jeremiah Anyete, a Black intern, and today with me, I've got fellow interns who will share their thoughts and experiences on the podcast today. You're welcome.
Hello, everyone. My name is Bolo Atife Ogungbeson, and I'm from Ogun State, supporting the Senate Committee on Education, Basic and Secondary.
Hello everyone, I'm Zainab Sanusi Jibia from Katsina State. I'm attached to the Senate the House of Rep Committee on House Services.
Hi, my name is Pamela Ephraim from Kaduna State, and I am interning at the Senate Committee of Foreign Affairs.
I say welcome, everyone. How has your internship been like at the National Assembly?
Okay, mine has been interesting and insightful. Insightful that I got to have access to resources that I normally wouldn't have access to, which has improved my knowledge on a lot of things, including policies and laws. And then interesting that I get to meet people who have gone out a lot in this span of 1 month.
And during our discussion, you made mention of an interest in becoming an education minister.
Yeah.
I look forward to that future.
Thank you.
Zainab, how's the internship been like?
Actually, my internship have been insightful. I've really learned a lot about how bills are being made and how policies are made within this 1 month I have been at the House of Reps. Aside that, I've been attending the plenary sections where I get to see our lawmakers debate on different topics and bills. So it have been really fun for me, actually.
I can tell. Pamela?
It's been a very eye-opening experience for me and a very fun one too. Fun for meeting all of you that I didn't know as of 2 months ago. So it's been fun and very eye-opening because I think we all had misconceptions thinking we know what goes on at the National Assembly before we got in there. So it's what you thought you knew versus what you are now realizing.
Yeah.
So it's been very fun.
And so I think it's the point when you realize there's a lot of paperwork that go into legislation. It's beyond the talk, the plenary discussion and sessions there. And well, that's good. So let's get back into what we are here for today to talk about health in Nigeria, especially on a large scale. And but let's start off by asking, are Nigerians healthy? You think Nigerians are healthy? And yeah.
That's a very interesting question because if we want to answer this question based on key public health indicators, such as life expectancy rates, which is basically 55, one of the lowest in the world, and then maternal mortality rates, child mortality rates, and malnutrition, then we're going to say a vast majority of Nigerians are not healthy. Compared to even our neighboring country, Benin, for example, where life expectancy rate is higher, where maternal mortality is lower, where child mortality is lower, Nigerians are not healthy based on these key public health indicators.
We'll come to what government is doing or what government is not doing, but still staying put with the subject of the health condition in Nigeria. There's this often overlooked sector that has to be the mental health. Do you think there's enough advocacy in regards to that? Because beyond, we just talk about health, we most times reduce it to physical well-being. Yes, but what about mental health?
I mean, it's even with physical health that we can even measure. We can say that Nigerians are not even healthy based on things that can be assessed. And then mental health that most people, have you ever done a mental health check, Jerry?
Yeah, not.
So for mental health that people don't even check, there's no data, it's insufficient reporting. We're literally on advocacy level. And even the advocacy level, many people think is a joke. People make so many jokes about it. Everybody's mad in Lagos. Like, does that make it okay? Like, we have normalized so many mental health issues, and if we want to talk about mental health, then we'll probably, I don't know, there's insufficient data for us to even say if Nigerians are mentally healthy. But yes, health is beyond the physical. So when we talk of the physical and mental social health, then a vast majority of Nigerians are definitely not healthy.
That's a very sad one, really, compared to other countries who are doing quite well. And you really can't have a productive society that is not healthy.
Exactly.
All right. So moving on from that, what's the level of coverage in terms of insurance like? Because most times, whenever we have the government, it's about, oh, we funded a certain number of primary health centers and we've been able to bring this number of persons. As a matter of fact, the government has said it has brought in about 22 million Nigerians as insurance. But I love you, Bolu, to speak on that.
Do you know that the Healthcare Providers Association of Nigeria reported last year that 90% of Nigerians do not have health insurance.
Interesting.
And it's crazy. Let me test run it. Do you have health insurance?
I don't.
Do you have health insurance?
My job provides.
Do you have health insurance?
Yeah, I go on this year.
This year. So that means that you are not part of last year's data, but
Yes, yeah.
so I feel like this is also this is also caused by lack of information. There are people that don't know so much about health insurance. They know that there's insurance, there's some things like that, but they don't know the benefits. They don't know so much about it. Then there's lack of access, proximity. Is it Emeka spare parts in one shop in the tick village that will say he wants to dust his shoes and come outside and go and register to get health insurance when all he thinks about is money. So it's really unfortunate. We've not quite covered a lot, and I'm hoping that in coming years would do better.
Like you made reference to a spare parts seller.
Yeah.
That's an individual.
Yeah.
And I would love to come back to you, Pamela. Do you think the problem we're faced with at the moment in Nigeria is the individual negligence, relegating their health to the background and thinking that prioritizing money, making money over their health, or a systemic problem?
Honestly, I think a significant part of it is systematic. Yes, there's a systematic failure. I don't know if perhaps our population is way too large for the resources. I mean, 90% of Nigerians that are not covered by health insurance. Like, so just 10% of probably a very privileged part of Nigerians. Because, okay, for me, my job provides compulsory HMO. If I didn't have a job, if I was unemployed, I probably would not have health insurance. So I don't know how that works for somebody who is unemployed, or for a petty trader, or for a farmer. I don't know how they're included in all those things. I remember before the HMO used to be only for
The civil servants.
certain public servants, and then now so many private organizations are making it compulsory for their staff. So I don't know how that works, but I think there's a systematic failure. And then, of course, there's individual negligence. People are prioritizing survival over health. People are thinking of how they're going to eat today. They're not thinking of how their kidneys might fail in the next 10 years. So, but no, the systematic failure is a significant part of it.
You want to add something, Zena?
Okay, based on what she said, like most, especially the rural areas, when you were talking about, like, when you're telling them about this health insurance and all of that, they'll be like, when I haven't eaten, I don't have money to eat. Is it the one that will now use to go and pay for an insurance? So the most people are not really educated on this advocacy. We need to do more on the advocacy part. We need to tell them about the advantages of having an insurance. I think that's one of the first step before we think of other things. Yes.
Okay, but in as much, I'm glad you made mention of systemic failure, that is, because I know in certain countries where people get packages when they are unemployed and such, and of course, health is expected to be prioritized in such system. And I also know that in Nigeria, the government has introduced certain policies to help cushion this, to lift people out of poverty, to cater to the professionals, those in corporate organizations. I love us to talk a bit on that, and we examine what are the gaps. Have they been effective or otherwise? I'll start with you, Zainab.
Okay. So one of them is the Nigerian Jubilee Fellowship Program, whereby youths, mostly graduates, are being employed for a fellowship program so that they'll have the experience. It's just like a graduate training program so that you have the experience on how the other world look like, the corporate world look like. And me personally, like I have friends that benefit from this program. I have 3 friends that benefit from it, and they do receive 150,000 naira every month and some stipends for transportation. So I think that's a very good initiative to help people, to give people employment and to make them have that work experience. Yeah. And aside that, also there's the school feeding program that was implemented. Some states had it. Even my state personally, Katsina State, the Empower program went for some time. You know how Nigerian policy stuff is that. So during the course of that Empower program, students were being given good food. The people that were employed to cook, they were being given employment, and even the parents, the burden of feeding their children was taken out of, yes, was taken off them, and students were even more excited to go to school because then they're okay, when I'm going to school, I'm going to eat a very good food and all of that.
And good food obviously promotes good health.
Yes,
Yeah.
yes.
Absolutely.
So, but the way it is now, like I don't know, most of those schools now, the program is not going on. I don't know why, and I think we need to really look into that.
I
to
think
know what's going on.
the school feeding program was a really good initiative. I don't know, the consistency, the sustainability of it is the issue. But for just for the fact that encourage school attendance, children are going to school looking forward to eat food.
Yeah.
And then the fact that it solves malnutrition.
Malnutrition.
Yeah, that's significant. But sadly,
And you know, like when you're really fed, you even concentrate more
Yeah.
in your academics. You don't have to think of, okay, what am I going to eat and all of that. You just concentrate on what you're doing there in the school.
More like government's giving out incentives to
Yes.
students. So when you go to school, you go back home, you're like, okay, I don't mind going up to BSc level because I
Yeah,
government
because
takes care of
Yeah.
basic things. And
I think there's a country that pays students for going to school. Yes, I can't remember the country, but yes, there's a country that does that.
all right. Let's turn our attention a bit now to out of pocket payment when it comes to health. And we know that, like they say, that Nigerians are one step away from health related problem that would drain their pockets. What does that mean to you? As a Nigerian, Zena?
Okay, paying out of pocket, that's when you were sick.
Yes.
Sometimes, like, sickness is not just something that you can just be healthy today and then tomorrow you'll be sick. So that out of pocket stuff, I don't think it's really that it's really effective, because sometimes you wake up, you're sick, and then you don't have the money to go to the hospital. In that case, like, you're just there, you don't have money. Most times, like when I'm talking, I like giving examples with the rural areas because I'm into public health advocacy. So sometimes when you go there and you're talking to them, they'll be like, see, I don't have money. Even if this sickness should come, my parents, they were sick, so nothing happened to them. They even lived long. And some of them, you'll be like, okay, you are having malaria. Take your child to the hospital. They'll be like, no, forget about that one. There is mango leaf. I'll just plug everything and then I'll cook. And all those things. There's no prescription. Like when you're cooking all those mango leaf and all of that, they'll just pack them and then cook and give the child. And most times, like, some research shows that all those stuff that we're taking, they have what's it called? They cause some kind of
Adverse
improvement.
effect.
Yes, effects to our kidneys because of all these things. Like, they have the chemicals are more concentrated. You don't even know the amount. Like in hospitals, do they use plants to make medicines in the pharmacy?
It's
Those
measured.
places, yes, it is measured. But you just in the rural areas of like, okay, you are sick, just take this one, take that one, and that case, you'll be healthy for some time, but that sickness is not gone. Something like malaria now. Malaria, when you're treating malaria, there are some dosages, and there are different varieties of malaria. We have the Plasmodium falciparum and all those things. Like mostly in Nigeria, if you should go to the hospital, just say that you're having Plasmodium falciparum. Whereas there are other varieties of it.
They have Vivax. They have
Yes, they have Vivax, yes. And then the diagnosis, like they'll just give the drug for that. And people, you don't know okay, you're having plasmodium falciparum, they gave you dosage for you to take for like 4 days, your drugs, and then you just take it for 2 days and be like, I'm already okay, I'm strong, and then you dump it. And all of this, what's it called? This plasmodium, these pathogens, they have like a life cycle. After like for plasmodium falciparum, there's okay, maybe most of all this, like when you're having malaria, let me just use normal example without going too scientific like that. So when you're having like malaria, most times when you're having malaria, in the morning you'll be healthy. And then most times towards when it's already when the sun is rising, your body will now be weak and all of that. That has to do with the life cycle of the pathogen. During the daytime, you'll be feeling healthy. But then during the and even that's when you now feel that that's when like the life cycle, when it's affecting your blood cells, because it has like a long life cycle. So people will be like, okay, maybe when I take this drug, I'm okay now. They'll just dump the drug. I'm okay. I must not finish my dosage. Whereas the plasmodium is still in your body, and you are not really curing it.
Yeah.
So I think we need to, even us like the middle class, outside the rural area, we need to take out, like when you're taking a drug, read your prescription. Aside just going, because most people nowadays they just go to chemist, they'll give you drug without, okay, the chemist, they told you to take it maybe like twice a day. Forget about the own prescription. The pamphlets that is inside drug, go through it, read it, and then know how you're supposed to take the drug. So if like maybe when you're pregnant and they're over writing in prescription, pregnant women don't take, or this is the dosage you're supposed to take. Without, okay, mostly we have quack. Most of these chemists, most of them, they are quacks. They'll just give you, oh, yeah, go and take it, and then you just take it like that without really reading the drug, knowing more about it. And thank God for we have ChatGPT and other AI tools now. If you haven't prescribed like a drug, you can even use the AI to ask, know more about it before taking it. So I think we should really do more on that.
I love the fact that
Nigeria.
you highlighted personal responsibility
Yeah.
when it comes to
Taking.
remaining healthy. And because today's podcast is focused more on health beyond hospitals, beyond the medications we get, I would love us to talk a bit more on that. And I'll come to you, Pamela. Now, what are the suggestions? Okay, take cognizance of in terms of remaining healthy. I know we know the environment you live in matters a lot. Okay, and but do you think Nigerians take cognizance of this?
Okay. I mean, listening to Zainab speak, I'm just thinking in my head about the correlation between education and healthcare. Like, you cannot even separate both at all, because it's almost the same people who prioritize education, they also prioritize their health, and it's because they understand.
Yeah.
So it just shows the role that literacy even plays in. And as much as we say, the government is responsible for so many things, which they actually are. I mean, I think personal health starts with ourselves and our level of understanding. Well, if somebody doesn't understand, for example, why they should even go to a dentist, they say we should clean our teeth like twice a year.
I change your brush
Every 6 months.
every 3 months.
Change your brush every 3 months and then go to dentist to clean your teeth at least twice a year. But for somebody who doesn't even understand, they just think as long as their teeth is white, as long as it's not paining them, like why should they go? Why should they go spend their money? But for someone who is very educated and understands why, they would go. And of course, we cannot even take out social capital from economic capital from all of this. Like we said earlier, somebody is prioritizing survival. You're not going to be telling the person to go to the dentist when their teeth is actually not paining them.
Yeah.
So
A friend of mine has been selling insurance to me. So Jerry, insure your children's future.
what kind of insurance? Health insurance?
No, yes, part of it, and education. I just told them like, hold on, is it?
So they're saying that even your unborn children, you don't have kids yet,
Kid,
you can start saving money for their education. I think that's a great.
that's the point. So exactly the point. It's a good one, but then you're trying to remain alive at the moment.
I know you do your own now. When you do your own,
You
not
keep
your
like
children's
percentage, but then
I think another problem is short term thinking. Everybody's thinking about today, then nobody's thinking about tomorrow. And I think religion plays a huge role.
Apart from religion, do you know the value of naira was a couple of years ago? Can you say it's the same thing, right?
I understand that, but religion plays a huge role because somebody thinks that if one disease, if like my solution is to go to church, I'm healing miracle, like that's the only thing, that's the only way out for me. Like people, I mean, when you're selling health insurance to somebody, for example, and saying, oh, you have to save certain amount in case your diagnosis, God forbid.
Only Jesus can secure my life.
Exactly. So that's the health insurance that people is able to go for. So it's really hard to sell health insurance to Nigerians with the.
But it's important.
Yeah.
It's extremely important.
Very
Now,
important.
let's still stick to personal responsibility. Now, for an individual juggling 2 or 3 jobs, what would you advise?
I feel like if you're juggling 2 or 3 jobs, then you'll be earning like maybe a good amount of money to be able to take aside. Let's say you cannot take breaks. Go and take ice cream. Go and sit down. Take ice cream. Go if your money can help you to get it. Go and get a spa treatment.
Yeah.
Just do something nice for yourself. Do you know that they say that there's one thing that they say, I think happy men live longer. There's something about people that are happy, yes,
Yes.
and they look younger.
Prioritize your
Prioritize your happiness. So when you're happy, you are healthy.
self-care.
Beautiful submission so far. So let's turn our attention then to what the government role should be. Now we know that, as we all mentioned at a point, that we get so much of policies, interventions that really last a term of 4 years. Now, Pamela, why do we have this gap between policy, implementation, and sustainability?
I think that a major issue is weak, and this even goes back to being educated, weak community oversight. For example, the government has budgeted millions every year. Millions is budgeted into the healthcare sector. But does it get to the people who really need it? That's the question. And if the people who really need it do not get it, how do they communicate this? So for me, as a daughter of a healthcare provider, my late mom, she was in charge of a primary health center. And I remember a few years ago when the primary health center where she was working as was being renovated. And it was all over the news that the government was renovating, the state government in my state was renovating, Kaduna State, they were renovating primary health centers across the state. And then I noticed like certain primary health centers that were close to the city center, they had been completed. And then the primary health center where my mom worked was left, they were just making use of a makeshift shelter while the main structure was still ongoing and it wasn't being done. It was like the contractor abandoned the project and nobody was doing anything about it. Thank God my government was very active on Twitter and on social media, and they had a phone number that people could report. I called that phone number and reported, and I said, this primary health center in so location has been abandoned. There's no construction has been going on there for like 2 months. And they were so happy that they got that tip. And I'm telling you that within 1 week, the project was completed. So if I had not reported, and I don't even know how I would have reported if not for social media. So I'm grateful for social media that I was able to find a number that says, oh, reports anything that has to do with the state projects to this number. And I was able to call and to report, and they followed up. So I think weak community oversight is a problem. If you go to a primary health center in your community and there is no nurse on duty, or drugs that are supposed to be free, sometimes they even write it like they receive donations from some organizations, and they say this medication is not for sale, and they tell you they are selling to you. How do you report? Who do you report to? Like, people don't even know. But we just keep saying the government. We are the government. Like, we have a role to play to inform the government. Like, the government is not even aware. I just keep thinking of that renovation in my mom's, in the primary health center where my mom works. Like, if I had not called to report, maybe till today, it would have still been uncompleted. It would have been abandoned. Yeah. So weak community oversight is one of the major accountability issues that we're having. People have a mindset that even if you tell them, what would they do? But tell them first and see. Like, so I'm glad I told them and something was done. So I think that we should, but people need to be aware, fully aware. Maybe there should be a phone number that people can call to report health any health issue in encountered in any health facility across the country, there should be some kind of call center that you can reach out to, and then it should be followed up to. And then I think also the media. Yes, I am a journalist, and the media has a huge role to play. I've seen last year in 2025, Premium Times did an investigation in Akwa Ibom, your state, where they investigated the government allocation to primary health facilities in the state, and to the point that the state governor had to declare a state of emergency on the health sector in the state. It's like so much money was being disbursed, but it's not, people are not receiving the services that needed to be received.
Let me turn over to Zainab. I know you are one of the health advocates. I'd love to know what role can organization like the one you participate in, can they play in terms of holding government, ensuring that policies are not just press releases or policy documents, but then they translate to better quality of life at the rural area, which of course you're very passionate about.
Okay. My stay at the National Assembly, I have been attending plenary sections, and during my attendance, I've noticed that even members from the public health advocacy, they've been coming for it. And during the public hearing, you're being given the space to display your memorandum and also debate on certain bills. So I think that's one, like it's a very good one. Since the last one I went for, I think it was on the establishment of a center. I can't really read out the bill here. I can't really remember actually. So when other like different organizations they came for it, even me, then I was like, when I went there, as an intern, I didn't even know how it really worked. I thought maybe during the public hearing, you'll be given an opportunity to talk. Nothing like that. You have to
To be invited.
yes, and we have to give them a memorandum and all of that. I was just sitting there waiting for them to like, okay, if you have anything to say, point to raise up your hand. And though I had like one problem that we really have in this country, we have a lot of facilities. We have them health facilities like different establishments, but the major issue we have is the issue of implementations. We have very good policies, lots of good policies regarding different, like we have for the tuberculosis, the public health diseases, and all of that. But the policies are not being implemented, and we need to checkmate that. We need to follow up by attending public hearings and giving our own oversight on all of that too.
All right, you basically took out the question off my script, and let's talk about the role of various committees. We are legislative interns, and then we get to see how oversight is carried out at public hearing and such. But I'd love to talk about it because I know you're also very passionate about the health sector. How can the committees at the National Assembly, even at the various state houses of assembly, carry out their functions to the extent that we have a better outcomes in terms of healthcare?
We had a bi-weekly last week, and then Dr. Luke talked about how it's very important to employ professionals in this committee, professionals in that particular field that you put them in, so that they will understand. It's only professionals that will know that, okay, this is a sustainable plan. Oh, okay, this bill is great. If we move forward with it in the next 10 years, this is what we're expecting. So that when they go for oversights, they will know what they're doing. They will not just go for oversight because, we just want to go for oversight, or I'm counting the number of states I've gone to in Nigeria. They're going they're going for quality assessment to know that this project or this thing that we're doing, are you doing it the right way? If you're doing it the right way, how much progress have you made? Or if it is not working, do we need to go back to the drawing board and work on something better and bring it back? So yes, what is very, very, very important, employing the right people for the job.
All right.
Yes.
And that's where I think what we've buttressed so far is that there should be a working relationship between the citizen and the government. Government, of course, including the executive government and even the legislature. And of course, like Pamela mentioned, there should be consequences for this. We also talked about individual taking responsibility. It's very important to remain healthy, irrespective of how you choose to juggle 2 or 3 jobs because of today's reality. But then else is well. So as we wrap up the podcast for today, I'd love to probably want to share one insight or the other on the podcast so far.
What I'll say is very, very simple. Prioritize your health, because all this money you're working for, if you don't eat it now, somebody will help you and eat it.
That's a very
It sounds funny, but though,
It's
but
true.
yeah, it's true.
yeah.
Okay.
Yeah, Zainat.
Okay. What I would like to say is that as a public health advocate, I want you all to aside the normal like way of even if you not go to school, you don't have that formal knowledge, try to educate yourself, try to like in different you must not even be learned in like English language for you to learn some things. Meet professionals. Like in the village, meet professionals like in the hospital, you don't understand something, meet them. They should explain it in your local dialect, do you understand it? So I think human like we should be responsible for our own education. So you must not go to school for it to know something.
Yeah.
Meet those people that are good in it and need them to educate you too. That's what I would say for now.
All right, thank you very much, Pamela.
I think my desire is mostly for mental health. I truly wish you'll be taken more seriously, and mental health services should be available even at the primary health care level. Like that would be amazing to be able to walk into a primary health center and have a counselor or a psychologist to speak to and say, I physically am okay, but mentally this is how I feel. And I mean, may my dream come true.
For me, I'll say that every life matters. And as much as we look forward to a better healthcare system, we must remember that behind the numbers we read in the newspaper, there are people behind those numbers. Their fathers, their uncles, their mothers, and we must take personal responsibility. And of course, we are asking the government to step up and play their own responsibility, their role as well, ensuring a healthy, which of course will lead to a more productive society. It has been amazing doing this with you. My name once again is Jeremiah Anyete. This podcast is sponsored by the European Union under the European Union Support to Democratic Governance in Nigeria, EU SDGN2 program.